It's actually probably the most important question, even in my work. So trauma is probably the single biggest driver. I would say trauma is the gateway drug. If we look at many, many studies, there are kind of two different things that drive someone's risk of addiction. One is genetics. It's about 40 to 60% genetic, similar to diabetes in terms of someone's risk. That's not a done deal, obviously. There are people with strong genetic risks who never develop addiction and people without that who do. The other half of the equation is based on kind of your exposures and your experiences. And one of the number one drivers is what we call adverse childhood experiences. There's this famous study called the ACEs study, which stands for adverse childhood experience, and it's been replicated. There's a recent one done actually in Europe as well that looks at the number of adverse childhood experiences you have, and it's a linear track increase in terms of your risk of substance use disorder. So if you think about what's happening in the brain with substances, when we use alcohol or drugs, all sorts of feel-good hormones are released, right? Dopamine, your endogenous opioid system, which is literally your natural pain reliever. And if you take someone who's experienced trauma, there's great relief that people can find in substance use.